When I got to Gaudenzia, and I think it's probably still true, over 50% of the employees I had, and I had 1,300 staff, were people with lived experience, were graduates of programs like Gaudenzia or Gaudenzia itself. So a lot of lived experience, a lot of peer related stuff. A lot of it was unregulated for years and years and years, a lot of untrained people, but people had passion and commitment. And it's a very powerful model. And obviously, uh, uh, on the mental health side, that's been taken up more and more. I hate to think of it as a way of getting productivity and activity out of staff at lower cost, although I think that fits into it because you pay a PhD or an MD a lot more money than you pay somebody who maybe has a high school diploma but a lot of lived experience. But they're not really substitutes. What you need is a whole cadre of people with different skill sets to be able to do the work.